Welcome to the topic of self-monitoring of blood glucose, short Smbg. Self-monitoring of blood glucose is an essential part of diabetes therapy. It is relevant for patient empowerment and better self-management, and finally also decision-making. It tells the patient what the physician or the pharmacist or even the HbA1c cannot. Right from the beginning, it is important to keep two things in mind. For you, as a healthcare provider, it is important to recommend the patient to use Smbg for his own management, to monitor his glucose values, and to learn about the effect of eating, of physical activity, of different behaviors, as well as medication and avoiding hyperglycemic and hypoglycemic events. The second key aspect refers to an accurate glucometer. Self-monitoring of blood glucose only has a value if the patient is using an accurate device. So, when recommending Smbg to the patient, make sure that he uses the right glucometer, because as more accurate the meter is, the better decision the patient can make. In this module, we show you that Smbg is a key part of diabetes therapy, but its use varies between different patients. It depends on the diet or the therapy the patient lives on, the number of insulin injections per day, using an insulin pump or not, or the type of diabetes the patient is suffering from. As a second step in the module, we try to be very practical and to give you recommendations how individual patients with diabetes and different diabetes needs and different therapies should monitor their blood sugar using Smbg. We also show you what consequence this may have in adjusting insulin dosages or learning about the effect of meals and physical activity. Finally, we shortly address other methods of continuous glucose monitoring or flash glucose monitoring, and we give recommendations how to use these technologies. My personal message to you is: self-monitoring of blood glucose is a key tool and is of key importance to the patient and to you. It helps the patient to manage his diabetes and to avoid hypoglycemic events. But please keep in mind, the power of Smbg can only be fully used by using an accurate glucometer.